Hello everyone, Pramu here to share the chapter on blood group alleles and hematological disorder. So, blood group alleles are the major classification of ABO, and in the remaining, we'll be seeing about the common hematological disorder, which is caused mainly of genetic origin. So, before going into the topic, let us get a glimpse of what is the general overview of blood. So, blood, we all know it is the circulating fluid, body fluid throughout the heart, through the arteries, capillaries, and veins. And mostly it is comprised of two major components. One is the plasma component, the other one is cellular component. So here the average male will be having around of 5.5 liters of blood, when compared to female it is 4.5 liters of blood. And the plasma is the fluid portion, which will be contributing 55 percentage of the blood volume, and the remaining will be water, that is 92 percentage, where it comprises of water, 7 percentage of protein, and 1 percentage of inorganic salts. So in short, plasma proteins will be comprised of albumin, fibrinogen, and globulins. So here the major plasma cells will be RBC, WBC, and platelets. Coming to the discussion on blood group balance, blood groups are being classified into ABO. So it is generally classified as A, B, AB, and O. But based on the presence of the antigen on the RBCs, antigen A and B, you can call them as based on the presence on the genetic basis, that is the gene makeup on the chromosome 9 also differs. There are majorly three main alleles involved, A, B, and O. So, what is A, B, and O? We'll see in detail about what is A, B, and O and AB. So, in this type A, the individuals will be having a genotype of AA or AO, and you can see that antigen A and will be clinging on to the RBC. When you take type B blood group, the individuals will be having their strains of BB and BO genotype, and they will be having B antigen on the RBC. When you take AB, it is clearly understood the individual will be having both A antigen and B antigen clinging onto the RBC. And the last type O is that they are having OO genotype, where there is no antigen at all. So the introductory part of hematological disorder is like it is mostly involving the blood and the problems which is around with the either the cells, copper cells such as RBCs, WBCs, platelets, bone marrow, lymph nodes, or spleen. Children are being experienced by a variety of disorders, while some are purely of genetic origin and some are being like it is of hereditary origin. So, how this hematological disorder can be the major root cause, or what are the causative factor for developing this hematological disorder, is that it can be divided into anemia, bleeding disorders, as well as blood cancers and blood clots. So, we'll be going in further about anemia. So, anemia means emia is blood and is reduced. So, reduced blood in the RBC, reduced blood count, that is RBCs in the blood is totally reduced, and or the hemoglobin. And then this results as a result of this reduced RBC, the oxygen carrying capacity is also reduced, which causes generally tiredness, weakness, and paleness for the client. So, this anemia will be a major genetic problem in the sense, like not in the case of iron deficiency, but in the case of sickle cell anemia or thalassemia, which we'll be seeing one by one. So, what is sickle cell anemia? In sickle cell anemia, the red blood cells become rigid and sticky, and they are shaped like sickles, or we call it as they are in the shape of the moon like pattern. These are usually irregularly shaped, and because of their shape, they are getting easily stuck onto the blood vessel, which is going to slow down the backflow of blood or block the blood. And due to the blockage, the tissues are deprived of oxygen. Yes. So, what are the signs and symptoms of sickle cell anemia? Most of the patients will be complaining of pain around the abdomen, joints, or both of the area. That is, both the area, they will be having severe pain. Some patients will be complaining of chronic anemia, frequent infections, It can be of upper GI or upper respiratory. In some symptoms, patients will be showing up malnutrition, short growth, and stunted growth, bone deformities, lethargy, and fatigue. So, this lethargy and fatigue is purely due to the reduced amount of HB in the blood. So, what will be the possible treatment? The treatment for sickle cell anemia is to avoid the crisis. So, we have to stop the pain or reduce the pain, and we have to prevent the complication for the patient and to live with the disease for lifelong. So, thereby they can increase the lifespan. Sickle cell anemia patients are always in need of continual care. So, here we can start in with folic acid supplementation uh, in order to increase the production of RBC, and also we can give some medications that will reduce the pain, and we can increase the fluid intake to have good hydration. In some patients, we can also go in for over-the-counter drugs such as analgesic or non-steroid and anti-inflammatory drug can be started. In certain cases, if the patient is having very painful crisis, then hydroxyurea is the treatment of drug of choice with acute chest pain syndrome, acute chest syndrome, which is pneumonic conditions. Or if it is very severe, then we have to plan in for antibiotics. If the patient is not improving further, then plan in for blood transfusion on regular basis, or in emergency crisis also blood transfusion is being planned. And finally, a curative procedure would be bone marrow transplantation. Sickle cell anemia, the allele responsible is autosomal recessive gene found on short arm of chromosome 11. When received from both the parents, the disease is inherited. The defective gene is known as mutation of single nucleotide or beta globin that results in glutamate to be substituted by valine at position 6. So hence we call this as HBS, not HbA. HbA is a normal adult hemoglobin, but here due to the mutation defect, we call the client with sickle cell anemia to have HbS hemoglobin. So the diagnosis, how the diagnosis can be further moved. So either we can plan in for peripheral blood smear, microscopic examinations such as peripheral blood smear to find out whether the RBCs are nucleated or if they are in the sickle shape, hemoglobin electrophoresis, HPLC analysis, and genetic analysis to find out the exact reason for developing the sickle cell anemia. So, what is HPLC analysis? HPLC analysis is the test which is done by high performance liquid chromatography. So, this is usually done in the laboratory to find a different type of hemoglobin in the blood. So, here we can diagnose whether it is due to thalassemia or it is due to any other sickle cell anemia. So the treatment of choice is start with IV or oral antibiotics. Painful episodes are being treated with analgesics. Hypoxia to be treated with auto administration. Acute chest syndrome to be treated with all of the above, that is starting antibiotics, analgesics and O2. And in severe state when it is not responding, when the patients are very deteriorating, then plan in for stem cell transplantation or gene therapy. The next important genetic hematological disorder will be hemophilia. So it is being derived from the American English, which is hemophilia, where usually the English people are being affected with this disorder, or we call it as the royal disease. So here it is mostly inherited through genetic disorder that impairs the blood ability to make clots. So, in case if the patient or if the client is walking or has a sudden fall, there is severe bleeding either beneath the tissue or externally. If the cut to injury is too high, the external bleeding is very heavy until we go plan in for some transfusions. So there are majorly two types of hemophilia A and B. So A is considered like they are having low amounts of clotting factor 8, and hemophilia B is due to the low levels of clotting factor 9. So these are usually inherited from either one parent through an X chromosome, and they are carrying a non-functional gene which is of majorly defecting this uh, clotting mechanism which causes severe bleeding in clients. So the major signs and symptoms of the clients is like starting from head, stomach, joint, spinal cord, and muscle. So when you go through this picture, you can see what are the targeted organs and what sort of symptoms the client is showing up. So in this, the client will be showing up of mostly the systematic symptoms, and here the high complaining symptom is joint and muscle pain, where due to sports injury or the child is getting fallen off during the toddler preschooler age, so that then only they are going for a screening that the child is being affected with hemophilia. So the major signs and symptoms in hemophilia is that you can easily diagnose with the signs and symptoms either in utero, or you can plan in for screening testing, that is complete blood count. In that we'll be able to find out how much is the hb, as well as we can find out how much is the hct and rbcs. APTT test, that is activated partial thromboplastin time. PTT, that is partial prothrombin time PTT, and fibrinogen test. So these are the tests which are being analyzed for screening for coagulations. So the treatment of choice in advance or conventional therapy. So majorly we'll be planning according to the level of the disease as well as according to the symptom. Or if the patient is having severe bleeding, then we have to plan in for some transfusion of factors. If depending upon the loss of factor 8 or factor 9 will be directly infused into the bloodstream. Before we go in for suturing, see that we start with the factors and then we have to go in for suturing or any other surgical intervention, because though you go in for the stitches and maybe sutures, it is not going to stop. The bleeding will be very heavy and it is not going to help out for the good prognosis of the client. So the treatment is that we have to plan in for giving clotting factor concentrates into the blood. Non-factor products such as either factor 8 or factor 9 can be given. Desmopressin is the common drug of choice until factor 8 is received from the blood bank. And in case if the bleeding is very heavy and you are not receiving any blood, then we have to plan in for and transamic acid, which is going to stop the bleeding. So the next hematological disorder due to genetically uh, genetic makeup, we can see that it is thalassemia. This is usually an inherited disorder passed from the parents to the children through genes, and this causes a major impact on the abnormal hemoglobin that results in inappropriate oxygen transportation and leads to the destruction of RBCs. So here the RBCs are very easily destroyed. Whereas in sickle cell anemia, the RBC is shape itself is abnormal, but it goes and does the coagulation. And in case of the other one, that is hemophilia, we saw that it is purely due to the uh, absence of factor 8 and 9. So here thalassemia. So here we can classify this thalassemia into A and B. So thalassemia A, which will be involving hemoglobin A and hemoglobin A2 and A1. So these are being inherited genes from the Mendelian's recessive fashion, and this is like it's also connected to the deletion of 16p chromosomes. In alpha thalassemia, it results due to decreased alpha globin molecules. So here beta thalassemia, in this picture you can see that the client is being having the beta thalassemia. So here we can plan in for the therapy such as supportive therapy. We can start in with the transfusion of leukoreduction viral testing, and iron overload can be prevented by starting with deferoxamine. And if in case it is due to endocrinopathies, then we have to plan in for hormonal replacement therapy. If the client is developing osteoporosis, then plan in for osteoclast replacements or vitamin D infusions. So here the Curative therapy is that we have to plan for experimental therapy, or we can plan in for hematopoietic stem cell bone marrow transplantations if the clients are willing. And if it is very affordable for the family, then we can plan in for gene therapy. The common complications of this condition would be transfusion induced infections, bone expansion on the head, hypothyroidism, hypoparathyroidism, venous thrombosis, and so on. So, here the treatment of choice for the thalassemia is that blood transfusion, iron chelation therapy, folic acid supplementation, and bone marrow or stem cell transplantations. So you can see that the symptoms of these clients will be like they will be having headache, delayed growth development, pale or yellowish skin, dark skin, and some child will be having facial deformities, fatigue, susceptibility to all types of infections. So that is also being easily screened at the developmental stage itself. So, to summarize the topic, we can see so far we were seeing about what are the major types of hemolytic disorders, and which is contributed by the genetic fashion. So, blood diseases and disorders affect one or more of the parts of the blood and prevent the blood from doing its job. That is, in case of any disorders of blood, it is not only going to target the blood sites, the vascular site, but also distant organs are also involved, which causes a major impact on the organ as well. So we have to plan in with the therapy with treating other diseases, what are the other medicines we use, as well as what are the dietary pattern we plan for these clients. So, hematological disorder, to conclude, we can say that it is primarily affecting the blood and blood forming organs. So, this should be early screened in order to prevent the complications. So, thank you so much for watching the video so long. If you have any doubts or queries, please put it onto the comment box and let us improvise the method of discussion further for your learning purpose. Thank you. So, these are the assessments which can be done after the content. So, you'll be able to list out what are the hematological disorder, what are the major causes of sickle cell anemia, what are the different types of thalassemia, and so on. So, on the other slide, further slide, I would have shown like what are the major books I've gone through the content for developing the content, and in case of any doubts or queries, don't follow to ask the queries onto the comment box. Sure to reply your all your doubts and clarify your doubts. So thank you so much for your patient watching. Thank you all. See you on next with another new topic. Thank you all once again. Thank you so much. Wish you all good luck. There are many websites as well where you can go in and you can go through. Thank you all once again.